and welcome to our special call-in show on coronavirus, where we have all your questions answered by the doctors. We have Dr. Vivek Nangia, Head of the Department of Pulmonology and Director of Fortis Hospital in Vasant Kunj with us. We also have Dr. Romel Tikku, Associate Director of Internal Medicine at the Max Healthcare Hospital. We have our lines open. You can start calling us. We already have our first caller, Tinu Thomas. Tinu, please go ahead with your question.
Good afternoon, everyone. I have a question. How do we clean the meat that we buy? I mean, let's assume the butcher is already infected, and if we buy meat from him, how do we clean that meat? Is cooking enough to kill the virus, or do we need to take some extra precautions?
Right, that's a query we often get, how to clean vegetables and even meat. Dr. Tikku, will you take that question, please?
Yeah, sure. See, after you get it back home, just make sure you wash your hands. And this meat also should be washed under cold running water. That's what you have to do. And if it's cooked well, it's not raw, then you don't have a problem. Cooked food is not an issue in any way. COVID doesn't get transmitted through food. So just make sure you don't handle it raw and it's well cooked. That's all. And make sure the hand hygiene is in place. That's all I would say.
Right. We also have our next caller. Right. Doctor, what are you saying?
Probably you could also wear gloves. Yeah, I was only saying that you could also wear gloves while handling the meat. I'm sure Dr. Tikku would agree with that, yeah.
And Ubaid Hajimi from Sopore in Kashmir is our next caller. Ubaid, please go ahead.
Yes, good afternoon to everyone. So my question is that should people who suffer from pollen allergy self-isolate if they develop typical hay fever symptoms?
Right. Dr. Nangia, will you take that question, please?
See, it's always better to self-isolate yourselves whenever you're having a cough and cold, because of course, we know it may just be a pollen allergy. At the same time, it could just be a common flu or a viral illness that could be spreading at the same time. So it's always better to keep your mouth and nose covered with a mask during this period. Self-isolate yourself, follow the cough etiquettes. Whenever you have to cough in your arm and not let the droplets spread around, and maintain strict hand hygiene.
Right. To follow up that question, Dr. Tikku, I need to ask you, there is a big debate about who should wear the mask. I think WHO is also debating on who are the people who need to wear the mask. But would you say, by and large, anyone who has infection should definitely wear it, and the others could then, take a call depending on what kind of interaction they have with people?
See, what the guidelines say and what the WHO says is that people who have symptoms or are sick, have fever, cough, they should be wearing the mask, and that's what we are following at the moment. But having said that, there are many countries like China and Japan where they ask everybody to wear a mask. And they've seen that the rates are definitely down with that. And this definitely needs to be looked into. And I seriously feel that people who are at risk, the vulnerable population, the elderly with chronic medical problems, they should be wearing a mask. What is the harm? What are we losing? Yeah, the flip side could be that you're running short of masks, and the ones who need it, the healthcare workers or the other people who actually need it, might not get it. But this has to be definitely looked into. I think we
would
should
you
be
say
a
that
little
any
liberal
cloth
with this.
can be put, any cloth can be used which is of a certain dimension?
Something is better than nothing, not the ideal way to do. But if you don't have a mask, you don't have access to it, yeah, that will also do. But I think the vulnerable population, irrespective, should be wearing a mask, especially if they're going out for groceries or visiting any pharmacy. Right. I think they should be wearing. We have to be a little liberal here. But again, everyone should not be wearing a mask. They've seen that the rates definitely do not go that down if everyone starts wearing a mask.
We have our next caller.
I'd like to clarify here one thing. Rick, can I just say something? I just want to give a clarification here that when Dr. Tikku is talking about a mask, he's talking about a simple 3-ply surgical mask, or probably a hanky converted into a mask, or any other thing, domestic, homemade kind of a thing, but not the N95 mask for sure.
Right.
N95 mask is to be left only for the healthcare workers who are attending to these serious patients and nobody else. Because we don't want to reach a situation where these N95 masks are out of stock and we are unable to attend to these patients or have to, do that at the risk of our own life.
That's an appeal that is being made by the doctors time and again through our program. Now we have our next caller, Soma from Samastipur. Soma, बताइए आपका क्या सवाल है?
मुझको एक्चुअली 10 दिन से गले में सिर्फ दर्द है और कोई प्रॉब्लम नहीं है, लेकिन गले में दर्द है.
Dr. Nangia, would you want to reply to her question? She says that she has got some throat pain for the last 10 days and she is worried because of that.
जी, अगर 10 दिन से गले में दर्द हो रहा है आपको, तो कोविड-19 होने की संभावना बहुत ही कम हो जाती है. फिर तो प्रॉब्ली कुछ आपने ठंडा या कुछ खट्टा लिया होगा जिसकी वजह से हो रहा हो सकता है. सो एक तो आप गर्म पानी के गरारे कीजिए, उसके अंदर थोड़ा सा नमक डाल के, कुछ थोड़ी मेडिकेशंस आती हैं वो डाल के भी कर सकते हैं. एक कोई छोटा सा एंटीबायोटिक का कोर्स भी आप कर सकते हैं, जैसे एजिथ्रोमाइसिन है, पर वो आप अपने लोकल डॉक्टर से या फिजिशियन से संपर्क करके ही कीजिएगा, ऐसे नहीं. बट ज्यादा चिंता की बात नहीं है, ये कोविड-19 के फीचर्स नहीं है.
Right. We also have Jayanti from Kolkata, our next caller. Jayanti, please go ahead with your question.
Yeah, good afternoon. My question is like now the country is under a lockdown for 21 days to contain the spread of virus. So what next after 21 days? People will go out and obviously all the active cases wouldn't disappear magically. So how we are going to contain that after the lockdown is over?
Right. Dr. Tikku, will you take that question? I think that's something many people are asking. How will we contain after the lockdown is over, because things are not going to improve magically?
Things will definitely not be normal after these 21 days get over. But we have to look at the other countries, China, Singapore, Taiwan. What are they doing? They're still having restrictions. They're not taking it easy. They still have travel restrictions. The ones who are quarantined, their phone locations are keeping track of their locations, and there's a strict fine for violating the quarantine, especially if a lot of people do it at the same time. They put them behind bars also. There's a lot of fine being imposed on them. But having said that, what I would say is maybe a total lockdown after 21 days might not be possible, but it again depends on the numbers and the situation at that point of time. The government has to take a call on it. But we can adopt a cluster approach, which is done by Singapore and Taiwan, wherein what they do is they identify these hotspots, hotspots where there are too many numbers. What they do is they concentrate on these hotspots where there are a lot of numbers and there are too many restrictions on these hotspots, so that the virus is contained there. And what they do is they ease out the instructions in other areas where there are lesser numbers. So what it does, it helps you to restart the economic activity so that everything goes together. You have to have a balance somewhere so that the hotspots are contained. In fact, 10 hotspots have been identified. These clusters have been identified in India, in UP, Rajasthan, Delhi, Maharashtra, Kerala, and Gujarat. And if we concentrate on them, then we'll be able to nip it. I think that's what we should be doing. The government has to take a call on that. That's just a suggestion from me.
Right. Before we go to our next caller, Dr. Nangia, I have to ask you a question. Is there a real worry about having, virus being spread by people who have no symptoms? The reason I'm asking you is we have been reporting the case of one person, one 56-year-old dying in Dharavi in Mumbai, and he apparently has no travel history. He hasn't gone out of the area. But the big question is then, how was he infected?
Right. So there is a huge population which would also be carrying which we call as an asymptomatic carrier stage, where people may be carrying the virus in their mucosal tracts, like the upper airways, like nose, nostrils, mouth, and still not be suffering from any symptoms. Their own immune system is actually able to control the virus at this level only and not allowing it to invade. And also sometimes in the incubation period, before the patient develops symptoms, the virus would still be present in the nasal tracts and the oral cavities. So even from there, the spread could be happening. That is why some of the countries are now resorting to wearing masks, across the board. Everybody is being advised to wear a mask, irrespective of the fact whether they are carrying any symptoms or not.
Right.
And these masks are those simple masks.
Right. We have two callers, Arnold from Ranipet in Tamil Nadu and Sunetra from Bengaluru. We'll first go to Arnold. Arnold, go ahead with your question, please.
Yeah, good afternoon to all. I would like to know that whether the corona is spreading through via newspaper or cardboard boxes we are getting through groceries and other things.
Right. Sunetra, please tell us what is your question.
Yeah, should I call now? Talk now. I'm from Bangalore.
Yes, please.
Okay, my question is about the currency notes that we draw from the bank. The other day I withdrew 10,000, so they gave me a bundle of 100 rupee notes. So
Right, the questions, there are similar questions. One is about newspaper, another about currency notes. Dr. Tikku, will you burst the myths around coronavirus here?
Sure. We have no evidence till now that newspapers can transmit infections. No case has been reported as yet. By and large, they are safe. But having said that, since it's a fomite infection, if the person who's delivered the newspaper, if he has the infection and he's coughed and he's touched the paper, very remote chance of that happening. What you can do is you can still sanitize your hands after reading the newspapers. You can clean the outer part with a wet wipe. That's all you can do. But there's no evidence till now that newspapers can transmit. How long the virus stays on these surfaces is again debatable, few hours to few days, or they say actually on cardboards it's 12 hours. But we don't know. It all depends on your temperature. It depends on where it has been, what is the humidity. And to answer the second question about notes, again, currency, we don't know. There is no evidence that it transmits the infection, but currency being handled by so many people, yet we have to be careful. Maybe what we can do is go for digital payments, use credit cards, Paytm, whatever. And if you're using your currency, the notes, what you can do is again go for hand sanitization. You can keep a small hand sanitizer in your pocket, and after you touch the currency, you touch your wallet, you can just clean your hands. But by and large, what I would like to clarify here is that this infection mostly happens by droplet infection. The chances of you getting the infection are more when you're in the vicinity of somebody who's coughing. The fomite transmission does happen, but it's about, say, 15-20%. Majority of the cases is 80%. And the viral shedding is also more, the viral load is more when it's droplet infection. That's why the infection rate is more in doctors, because they're in direct contact with patients who cough on their face. Sometimes they might not be using a mask or protection. That's why the healthcare workers are getting infected in Italy. About 60 healthcare workers have died there. So it's very important that way. So social distancing or physical distancing, that's what we should be worried more about rather than newspapers and currency notes.
Right. Dr. Nange, I have a question for you. You know, hand sanitizers are running out fast. We, the Indians, are very good at quick fixes. We call them jugaad. Is there a jugaad for hand sanitizers? Is there another way that we can make them at home and use them?
A 20-second hand wash is the only other replacement, and that's just with simple soap and water is good enough.
Right.
You don't need any medicated soaps. You don't need any antiseptic soap. Just simple soap and water, 20-second hand wash, where you wash your nails, you wash your webs, you wash your wrists, the back and the fore of the hands, and that's good enough.
Also, how important is it to wash, you know, the accessories that we carry, or keep them wiping constantly, like the cell phones, the bags, the pens, everything that we carry out and then, you know, get back home? Is it important to sanitize them on a daily basis?
Yeah, cell phones I feel would be, because cell phones are something which are in direct contact with your hand all the time. And there are times when you inadvertently touch something else and then pick up the phone because there was an emergency coming. So that is something that you'll have to be more careful with. Like if we are wearing our gloves, we would never ever touch our cell phones then. We would only touch them once we've sanitized our hands, and only then. So therefore, sometimes patients even complain, you know, that doc, we've been calling you and you could not take the call. What they don't understand is that our hands have been sanitized, and you know, when you are dealing with the patients, you have to keep the mobile phone away from you.
Right. We have our next caller, Sri Rahul from Hyderabad. Rahul, go ahead with your question.
Yes. So what can those in the highest risk category, old people and people with lung diseases such as, you know, bronchitis, what can they do to mitigate the effect of the infection as and when it happens? And what can they also do to mitigate, what can they also do to make sure the infection doesn't spread rapidly?
Right. Dr. Tikku, will you take that question, please?
See, the vulnerable population, the ones who have heart disease, or as you said, pulmonology diseases, lung diseases, they have to be extremely careful. If they get symptoms, then they have to probably get in touch with their doctor. If they have fever, especially fever, dry cough, and breathlessness, they have to get in touch with their doctors, because it could be a sign of COVID infection also. But there has to be a travel history or contact with a positive person. So one has to make sure that one gets in touch with doctors. But everything is not COVID. I would like to say at the same time that it could be a normal flu or it could be a common cold. But if the vulnerable population has symptoms, probably they will have to get in touch with their doctors. They might need a test depending on their history. And if they are positive, they have to be isolated. Their family has to be quarantined. and any contacts have to be traced, quarantined. That's very important. The vulnerable population has to be very careful, especially the ones with these lung diseases and heart disease and diabetics.
Dr. Nangia, would you like to add anything to that?
Yeah, so in addition to that, I would also say as a preventive step, what we all could do probably is go in for the respiratory vaccine. You know, we are taking all the regular precautions. I mean, the hand hygiene, the cough etiquette, the social distancing. Besides that, people who have a pulmonary disease, cardiac disease, any other predisposing disease like diabetes, malignancies, cancers, on immunosuppressant therapies, WHO says that they could actually take certain respiratory vaccines which could prevent them from having further complications of COVID-19. Like they could be prevented from a secondary infection. So the influenza shot and the pneumococcal vaccines, 2 vaccines are strongly recommended by WHO to be taken at this time.
Right. We also have our next caller, Imtiaz Christie from Srinagar. Imtiaz, go ahead with your question, please.
I would like to ask the doctors, can we reuse the mask? Can we wash it and use again?
Well, Dr. Tikku, will you answer that question, please?
Well, ideally, no, you're not supposed to wash it and use it. The masks are meant to be used for a single day. It's a single time use. Especially only after 6 hours, you'll have to dispose it off, or if it gets wet or dirty or infected. So washing and reusing of masks is not recommended. I wouldn't recommend it.
Right. As a follow-up to that question, I just wanted to ask how to dispose these masks. Dr. Nangia, can you tell me?
So these masks, you know, masks have to be handled very, very carefully. They're not something that you can just play around with. Once you've used them, please remember, once they get moist, whether you're with your own secretions or with secretions of somebody else's, then they are potent carriers of viruses and bacteria. So one thing is that you never touch the outer surface of the mask.
Okay.
When you take the mask off, you roll it the other way around and then wrap it in a polythene bag and then discard it. That's the, or if it's not a polythene bag, then any other paper bag, discard it in the paper bag separately. Actually, in the hospitals, we have a different biomedical waste management system where they are all discarded separately from all other wastes like the paper waste and the other toxic waste. So they're all differently discarded. But at home, probably what you could do is discard it in a paper bag and keep it separately.
Would you
and
say...
again, as far as reuse,
as far
as reusability is concerned, would depend on the kind of fabric also of what the mask is made of. You know, the typical 3-layered surgical mask that we use in the hospital, that cannot be reused. Right. But if there is something that is homemade,
a cloth mask can be reused.
Cloth mask, yes, it can be reused. You could wash it properly, thoroughly, dry it up in the sun, and then iron it at 60 degrees, and then reuse it.
Right. We also have our next caller now lined up, Mithun from Ahmedabad. Mithun, please go ahead with your question.
Hi, good afternoon. My name is Mithun I'm calling from Ahmedabad. So I just had a question to the doctors that since January, we have been receiving many guidelines, even from something where initially they said, no, there is no evidence of human-to-human contact, and then guidelines have been devised to a drastic extent. So, and even now with the masks, there are a lot of studies coming from Czech Republic and also Japan, where they show that generally people wearing masks have shown dramatic effects to countries with advanced not wearing masks. So how to, so the even the information from the experts has become something like information we'll receive on this WhatsApp, the common software which are so how to trust and how to go about this is in this age of misinformation. So when some of the things which experts are, they are periodically kind of changing it, how to go about it, how to
Right. Dr. Tikku, would you like to answer that question? How to deal with this, all this misinformation that is, coming through different agencies right now?
See, we don't have to fall prey to these fake news, which is on WhatsApp, and you might even get mails regarding that. But what we have to do is go for the credible information which is being provided by the government on TV channels and even on print media and on the websites. You have the ICMR website, the Government of India Health Ministry websites. These are the websites which you should be going to, or CDC or WHO. They provide credible information. They tell us the do's and the don'ts. They also bust your myths regarding food, regarding transmission, regarding vaccines, regarding treatment. And there are other helplines as well, government helplines, even private hospitals have helplines. You can call them up, you can call your doctors, your family doctors and ask them. I would tell you not to spend too much time on WhatsApp and social media. Just keep an hour or so, go for the news, credible channels, Doordarshan or the other private channels like yours, and take information from there rather than listening to hearsay and going by what people are saying.
Right. We have enough time for maybe two quick callers. Nazir from Srinagar has called in. Nazir, please go ahead with your question.
Good afternoon, all of you.
Good afternoon.
Sir, my question is, after keeping so many people in quarantine, some can be asymptomatic there, and after leaving them from the quarantine, can they infect others?
Right. Dr. Nangia, can you please take that question? After 14 days of quarantine, can someone still carry infection?
So the expected incubation, one thing we have to understand is this is a new virus. We don't know much about it, and we're expecting its incubation period to be something around 14 days to the maximum. So after a period of quarantining for 14 days, the chances that the virus could still be there in the body are very, very low. And there's always a possibility that you could acquire a secondary infection from outside if you were to roam around freely and come in contact with somebody who has that virus. So it is not that we will still be completely safe even after the 21 days of lockdown. Whenever it opens up, as Dr. Tikku said initially also, that we would still need to practice social distancing, still need to take all possible precautions to save ourselves from this infection.
Right. We have our next caller from Mumbai, Jignesh. Jignesh, please go ahead with your question.
Hi, I have a two-part question basically. One is there is absolute paramount confusion amongst common people. And thankfully, a channel like yours have been pushing that, how it is spread. So are we 200% sure at WHO level also that it is spreading only through droplets? Point number one is that. Question number one is that. Question number two is that, is there a chance, let's hypothetical situation, that I come in contact with unknowingly in contact with a COVID-19 patient who is a carrier, who's perfectly fine, not showing any symptoms. But is there a chance that despite passing on the droplets to me, I might still not get COVID-19? Is there a chance like that? These are the two-part questions that I have.
Or I'll just follow up that question, Dr. Tikku, if you can answer that. If a person is asymptomatic in the beginning and then later shows signs of coronavirus, would you say during that period of being asymptomatic, he or she still can pass on the infection?
Yes, with this virus, that's what has been seen in the data that we have till now. Because the peak viral shedding with this virus has been seen to be in the first 1 week only. In fact, 1 or 2 days before the symptoms actually start, you would be shedding maximum virus. So you could be infected to others during those 1 or 2 days that you are asymptomatic. But this is not a rule, but they've seen that this generally does happen with some patients. They can pass it on to others. And whether, coming to the question of whether you can get it if you're exposed to such a person, it all depends on your immunity, the viral load. You also can have asymptomatic infection, or you can have a mild infection or a full-blown infection. It all depends on the viral load. And having said that, what I would like to say is that there was a study done in Wuhan where they saw that the viral shedding happens from 8 days to 37 days on average, and the median is about 20 days. So that's why it's very important that after 2 weeks, 14 days of treatment or isolation, that's why we test twice so that we see that they're negative. With a lot of patients, we've seen like the test is coming positive 3 times, 4 times, 5 times also, because this is very important, because you need to isolate them further also if they continue to remain positive, or keep treating them with antiviral medication. So viral shedding is something which can happen. On average, it happens for 14 to 20 days.
Right. Thank you very much, doctors, for joining us on the show, and all the callers who called in with their queries on coronavirus. With that, we have completely run out of time. Thank you very much for watching.